Dr. Alex, you have been associated with a number of non-profit institutions, including AHPI, Anbai, and Kaho. As founder and patron, how non-profit institutions are contributing to medical research, and what are the challenges they face for promotion of research?
I'll probably go beyond your question, since I work both with government, private and mission and non-profit. I will ask all of you a question. Now in postgraduate medical education especially, which do you think is one of the most wasteful things that happen? Well, I was just discussing with Dr. Gulati, and I think all of us would agree that this thesis that most of the postgraduates write, not all postgraduates, both for National Board and for the Medical Council, 70,000 theses almost every year. And I think all of us would agree that this is a colossal waste of time, because, as was already mentioned earlier, it's a copy and paste. So I think this is not, this is one area, if we are able to address, I think we'll make a big difference, not only in private, not only in government, but all over the country. And to put in a nutshell, why is this situation? Why are MBBS people? I'm glad to hear that NMC is working actively. I know that the National Board is doing a fantastic job in trying to promote research. But in my opinion, having worked in various, I may be wrong, I think we lack a research culture. We are not taught that, we have started, but not taught that in MBBS. In post-graduation, we are taught that thesis is just something that you really don't take seriously. So I think it's very important that we introduce a research culture. And how do you do it? I must compliment medical dialogues, because this is one of the few functions where I've seen where research is being incentivized. Very rarely are research champions, researchers honored, and I think this is one thing that we need to look at. All the other points have already been mentioned. I think funding constraints, many of the institutions, and I must also say that there's this huge opportunity. It's not only in medical colleges and not only in DNB hospitals that there is scope for research. The smaller hospitals, 100, 200 beds, have huge scope. But as Dr. Harvinder said, they are not aware of what are the pros and cons of research. Unfortunately, in our country, the bottom line is money. And I was just quite pleasantly surprised to hear that profits or revenues are much better in a research institute. And I know many institutes which are doing well both in research and otherwise, and one of that is my alma mater, CMC Vellore. There are other problems that have been mentioned, but I think one of the initiatives should come from the government. I think they should try and make it easier for effective publication. We all know that many of the research projects from India, we don't have too much credibility, the quality is not very good. So I think each institution, and especially the NMC and the National Board, should take steps to start in encouraging research at the MBBS level, ensure that there is a research culture, and for a research culture you need mentors, people who are experts in research who also train their students. I think it's a long way off, but I think we can get there, because India as a country has really done well in many other areas. We have huge potential. If only 10% of the 70 to 80,000 theses are actually converted into research papers which are of quality, I think we would make a mark in the globe.